It's only £10 now.
The scientific advice is that if people do not stay 2 metres apart when outside, this pandemic will be worse. And yet this was Columbia Road Flower Market in East London this morning. The Prime Minister warning today that he may yet have to restrict people's movement further.
I don't think you need to use your imagination very much to see where we might have to go, and we will think about this very, very actively in the next 24 hours. We need to think about the kinds of measures that we've seen elsewhere, other countries that have been forced to bring in restrictions on people's movements altogether. Now, as I say, I don't want to do that.
Although the most clinically vulnerable people are already being warned to stay at home for the next 3 months. But on the front line, medical staff say they, in many places, still don't have enough personal protective equipment.
The fears of healthcare workers are that if we don't have the correct PPE, we can't protect our patients in the way that we want to. We won't be able to treat them in the way that we want to. And ultimately, that more people could die. And that's both healthcare workers, the patients that we're treating, and anybody else that we come into contact with.
And it is medics who have perhaps the starkest view of what confronts us. Listen to this respiratory consultant from the Ulster Hospital.
It is hard to actually convey just the enormity of the crisis that is looming for the NHS and so for everyone in the next few weeks. Huge numbers of people will die, and the only thing that will have any impact on this impending catastrophe is slowing the spread of this virus.
And that means keeping our distance from one another. Maybe there is still time to limit the spread of this virus to something that will not overwhelm the NHS, but we are pushing our luck. Carl Dinnan, ITV News.